Hi all, welcome back to my YouTube channel. The third trimester marks the final chapter of pregnancy, a time filled with excitement, anticipation, and important physical and emotional changes. As the body appears for birth, both mother and the baby undergo remarkable transformations that set the stage for a fast delivery and a healthy newborn. At week 28 and continues until birth. During this period, the baby grows rapidly and the mother's body prepares for labor and delivery. You can see what are the physical changes in the third trimester of pregnancy. First one is weight gain. Weight gain increases in the third trimester due to rapid fetal growth, enlargement of the uterus, increased amniotic fluid, placenta, and maternal fat stores. Thus, additional weight supports fetal development and prepares the mother for breastfeeding. Excessive or inadequate weight gain, however, may increase pregnancy-related complications. The next one is back pain. Back pain is common during the third trimester as the growing uterus shifts the center of gravity forward. Hormonal changes, especially increased relaxin, loosen ligaments and joints, placing extra strain on the lower back, will be causing back pain. Poor posture, muscle fatigue, and added body weight also contribute to discomfort. Next one is shortness of breath. Shortness of breath occurs because enlarged uterus pushes word against the diaphragm, reducing lung expansion. Also, increased oxygen demand by mother and fetus also contributes to this sensation. Although common, sudden or severe shortness of breath should be immediately evaluated. Next one is edema or swelling of feet and hands. Swelling of the feet and hands is caused by increased blood volume and pressure from enlarged uterus on pelvic veins, which slows blood return from the lower limbs. Fluid retention and hormonal changes also contribute. Mild swelling is normal, but sudden or severe swelling may indicate pregnancy-induced hypertension or preeclampsia. Trimester of pregnancy, hormonal levels are very high as the body prepares for labor and breastfeeding. These hormonal changes cause several physical and emotional effects, including the following. Increased progesterone levels. Increased progesterone levels elevated to maintain the pregnancy and prevent early uterine contractions. It relaxes smooth muscles, which can cause backache, constipation, heartburn, and frequent urination. Relaxation of blood vessels may lead to fatigue and dizziness. Contributes to increased body temperature and feelings of heaviness. The next one is mood swings. Rapid fluctuations and high levels of progesterone and estrogen affects brain neurotransmitters. Emotional sensitivity increases, leading to irritability, anxiety, tearfulness, or sudden mood changes. Stress about impending childbirth and parenthood can intensify these mood swings. Next one is sleep disturbances in the trimester of pregnancy. Progesterone initially causes drowsiness, but in the third trimester it contributes to poor sleep quality. Physical discomfort like back pain, leg cramps, fetal movements, frequent urination, all those things interferes with sleep. Hormonal effects combined with anxiety can cause insomnia or frequent awakening. High progesterone levels in the third trimester play a key role in maintaining pregnancy, but also contribute to physical discomfort and emotional changes. Also, it can contribute to sleep problems. These are common and normal during this stage of pregnancy. Now we can think about the main fetal developments happening in third trimester of pregnancy. First one is a rapid weight gain. The fetus gains weight quickly, mainly due to fat deposition under the skin. This fat helps with the temperature regulation after birth. Most fetal weight gain occurs in the last 8 to 10 weeks, preparing the baby for life outside the womb. Second one is brain and lung maturation. The brain develops rapidly, forming more connections needed for thinking, movement, and reflexes. The lung mature, producing surfactant, a substance that prevents lung collapse and allows normal breathing after birth. This maturation is crucial for the baby's survival if born near term. Third one is a response to sound and light. The fetus can hear sounds such as the mother's voice and external noises. It may respond to loud sounds with a movement or increased heart rate. The fetus can also respond to bright light shown on the mother's abdomen by turning or moving. During the third trimester, the fetus prepares for birth through rapid growth, organ maturation, and increased sensory awareness, making this a critical stage of pregnancy. These are the common symptoms which we can see in the third trimester of pregnancy. Frequent urination. The growing uterus presses on the urinary bladder, reducing its capacity. The baby's head may move down into the pelvis, increasing pressure on the bladder. This causes the pregnant woman to urinate more often, especially at night time. Heartburn. High progesterone levels relax the lower esophageal sphincter. This allows stomach acid to flow back into the esophagus. The enlarged uterus also pushes the stomach upward, worsening acid reflux and burning sensation. Braxton Hicks contractions. These are irregular, painless, or mildly uncomfortable uterine contractions. They help prepare the uterus for labor but do not cause cervical dilatation. Often called false labor, they usually subside with rest or hydration. In the third trimester, physical changes occur mainly due to uterine enlargement and hormonal effects, leading to frequent urination, heartburn, and Braxton Hicks contractions as the body prepares for childbirth. See the main nutritional needs in the third trimester of pregnancy. First one is high protein diet. Protein is essential for rapid fetal growth, especially muscle, tissue, and organ development. It supports placental growth and maternal tissue expansion. Adequate protein also helps to prepare body for labor and breastfeeding. Sources include milk, egg, meat, fish, legumes, beans, nuts, and soy products. Second one is iron and calcium intake. Iron is needed to support increased maternal blood volume and to prevent anemia. It also helps in oxygen transport to the fetus. Calcium is crucial for fetal bone and teeth development and to maintain maternal bone strength. Good sources include green leafy vegetables, dairy products, fortified food, and supplements if prescribed. Third one is adequate hydration. Increased blood volume and amniotic fluid require more fluid intake. Proper hydration helps to prevent constipation, urinary tract infections, and preterm contractions. Drinking sufficient water also supports nutrient transport and overall maternal comfort. In the third trimester, Increased nutritional demands support rapid fetal growth, maternal health, and preparation for childbirth. Making a high protein diet, sufficient iron, calcium, and adequate hydration is essential. Exercises and activities in third trimester of pregnancy. First one is light exercises. Light activities such as walking and stretching help to improve blood circulation. They reduce back pain, swelling of legs, and constipation. Light exercise also helps to maintain muscle tone and prepares the body for labor. Second one is prenatal yoga. Prenatal yoga improves flexibility, posture, and breathing techniques. It helps to reduce stress, anxiety, and muscle tension. Breathing and relaxation exercises are beneficial during labor and delivery. Please avoid heavy lifting in third trimester of pregnancy. Heavy lifting can cause strain on the back and abdominal muscles. It increases the risk of injury, uterine contractions, and preterm labor. Due to changes in balance and center of gravity, heavy lifting may also lead to falls. During the third trimester, gentle exercises and safe activities helps to manage physical discomforts, while avoiding heavy lifting protects both the mother and the fetus as the body prepares for childbirth. Main warning signs in third trimester of pregnancy. First one is severe headache. A persistent or severe headache may indicate high blood pressure or preeclampsia. It can be associated with blurred vision, dizziness, or swelling of face and hands. This requires immediate medical attention as it can be dangerous for both mother and baby. Second one is vaginal bleeding. Bleeding during pregnancy is not normal, especially in the second or third trimester. It may indicate placental problems, miscarriage, or preterm labor. Any amount of vaginal bleeding should be reported to a healthcare provider immediately. Third one is reduced fetal movement. A noticeable decrease in baby's movements may suggest fetal distress or reduced oxygen supply. Normally, the mother should feel regular movements daily. Reduced or absent movements require urgent medical evaluation to ensure fetal well-being. Warning signs such as severe headache, vaginal bleeding, and reduced fetal movements are serious and should never be ignored, as early intervention can prevent complications. Antenatal care in third trimester of pregnancy. First one is regular health checkups. Frequent antenatal visits helps to monitor the mother's general health and pregnancy progress. The healthcare provider assesses weight gain, swelling, uterine growth, and fetal position. Regular checkups helps in early detection of complications such as anemia, preeclampsia, or preterm labor. Second one is ultrasound examination. Ultrasound is used to assess fetal growth, position, and well-being. It helps to evaluate placental position, amniotic fluid volume, and fetal movements. In the third trimester, ultrasound helps to confirm presentation and detect any growth restrictions. Blood pressure monitoring. Blood pressure monitoring is essential to detect hypertension or preeclampsia. High BP can cause headache, swelling, and visual disturbances and may affect placental blood flow. Early detection helps to prevent serious complications for both mother and fetus. Blood sugar monitoring also important in third trimester of pregnancy. During the third trimester, hormonal changes, especially human placental lactogen, progesterone, estrogen, and cortisol, increase insulin resistance. This causes blood sugar levels to rise, increasing the risk of gestational diabetes mellitus. Regular blood sugar monitoring helps to detect elevated glucose levels as early as possible. Poorly controlled blood sugar can lead to excessive fetal growth, preterm birth, and delivery complications. Monitoring helps to guide diet, physical activity, and medication or insulin therapy if needed. Maintaining normal blood sugar levels supports healthy fetal growth and maternal well-being. Always be ready for the labor. A birth plan. It outlines the mother's preferences for labor and delivery. It may include choices about pain relief, birthing position, support person, and breastfeeding. Discussing the birth plan with healthcare providers helps to ensure safe and informed care while remaining flexible if medical needs arises. Hospital bag. Preparing a hospital bag in advance reduces stress when labor begins. It should include mother's clothing, personal hygiene items, maternity pads, baby clothes, diapers, and important documents. Packing early ensures readiness for unexpected or early labor. Recognizing labor signs. True labor signs include irregular, painful uterine contractions that increase in frequency and intensity. Other signs are lower back pain, rupture of membrane, water breaking, and blood-stained mucus. Also, it's called show. Recognizing the signs helps the mother to reach the hospital on time and receive appropriate care. Emotional well-being in third trimester of pregnancy. Anxiety about childbirth. As delivery approaches, many women experience fear and anxiety about labor pain, complications, and baby's health. Hormonal changes can increase emotional sensitivity and stress. Education about labor and regular antenatal visits helps to reduce fear and build confidence. Support from family. Emotional and practical support from family members and partner provides reassurance and comfort. Family support helps to reduce stress, depression, and feelings of loneliness. Encouragement and assistance with daily activities improve mental and emotional stability. Relaxation techniques. Relaxation methods such as deep breathing, meditation, prenatal yoga, and listening to calming music help to reduce anxiety. These techniques promote better sleep, emotional balance, and pain coping skills. Regular relaxation prepares the mother mentally for labor and childbirth. Thank you for your time and attention.